Good evening, sir.
Hi, good evening, Arul. How are you?
Good, sir. How about you?
Yeah, I'm doing good. So, how was your, plans for work going on? Like, you're searching for some job opportunities.
Yes, sir. Yes, sir. I'm just attending a bridge course here. It's a government-funded bridge course
Mhm.
for people who are internationally trained but find difficulties for the job.
Mhm.
Mm, but it's okay, but it's more of related to um, workplace ethics like that. But I'm just in the class for um, 2 weeks.
Acha, okay. So, when it will be completed?
It is completing by January, sir. First week of January.
So, what are the options available for you there for job?
Sir, so far I applied 2, 3 journals, like even from my PhD, like I did my PhD on nanoparticles. So I'm searching in this perspective, and also my interest is all on compliance, like I can go in a device or compliance assistant or associate. I'm planning the same, but I'm applying both. I don't know whether is there a possibility to get into it, because they are asking certifications too, and also they um, want experience. I have only 1.5 years of experience in ISO 13485. That too, you know about cell bios, right? It is not
Yeah, yeah.
too uh, strict. They are not following strict regulations. Just we are doing on documents, but not following. Uh, so I'm struggling little bit. So this master class helps me, and I'm managing both that class and this.
Acha. Actually, I was there with in Silvers, I think 7, 8 months back.
Oh, okay, sir.
It was the same situation. I don't know what is the problem. Nobody want to follow the QMS, and it's the
Mm,
management is also of the same. Like they are not very strict, very lenient.
okay,
Uh,
sir.
uh, so I then I left. Of course, I was a consultant to them.
Yes, sir.
So I left that, and I thought not to come. Not to go ahead.
Mm. Even as juniors, we say something. Senior managers are not ready to accept. So it's okay, but
Yeah, actually, the management has to take care and implement it.
yes, sir.
Whenever Sri Kumar comes, it will be very serious. Once he
Yeah,
leaves,
right. Exactly, sir.
everything will everything will be normal.
And he likes to do, but from finance perspective, he's not bothering. Okay, when it comes to finance, he will step back.
Yeah, yeah. But I know, like Rulmati, there. Through some internal sources, I understand that there is some dispute between brothers,
Yeah.
Saravanan and Sri Kumar sir,
Sri Kumar, sir.
on the property issue what they have, and yeah, it's going on. Like they have some property in their village and other things.
Mm.
So that was the issue. Uh, and hence there is some. Of course, outside they look to be like friends, but we don't know what's happening in the
Inside,
background.
right?
Yeah.
Yeah, yeah, true, sir. Sir, I'll send my master CV. to you, check if
Yeah,
I can
I'll
do
review your
anything.
CV, and I'll also said no. I mean, I'll post your CV from my LinkedIn.
Okay.
Okay. For any freelancer jobs
Okay,
or
sir.
any jobs that I mean you can do from Canada or in from Toronto.
Okay, sir.
Okay, I'll
Thank you.
review it and I'll post it in my LinkedIn.
Sure, sir. Sure. Thank you, sir.
Okay,
Thank you, sir.
yeah, fine. Yeah, Vaibhav, like when are your internal audits? Hi, Madhusri, how are you?
I'm good, sir. Thank you. How are you, sir?
Yeah, I'm doing good. Thanks for asking. Yeah, your office is over early today.
Uh, Today was sports day, so
Acha.
we left.
And where is Somant is not joining, like even
So
your,
he's been in hometown actually. Don't have idea.
acha,
Uh,
is, but he is coming to you, I mean, he's attending the company, no?
I think Thursday he went back to hometown, sir. But he's coming to company. Yeah.
Acha. And what about your senior, Anisha? Anisha, she'll be in touch in WhatsApp but won't attend the class.
So
She's
yeah.
your she's your team leader or she's the head of QA and RFIU?
So she hasn't worked actually. Kind of team leader. We have different kind of organization chart.
Mm-hmm.
So she
Yeah,
hasn't.
acha, acha. Yeah, I know. I totally understand the structure of Intuitive.
Yes, sir.
Yeah, Sumant, you live for 100 years. Okay, just
Oh,
now
okay.
I'm reminding.
Oh, okay, sir. Thank you for reminding me. Good evening, sir.
Yeah, good evening. No, just now I asking Madhu about you.
Oh, okay.
I understand that you are in your hometown.
Yeah, sir. Some I am occupying with some other things continuously.
Okay. Okay, I mean, we'll wait for 3 minutes, another 3 minutes. I think two, three people said they will be joining on chat or somewhere on my WhatsApp, I think.
Okay.
See, guys, those who are present, there are two important things which I want to discuss. One is on, yeah, let me be visible. I also hide. We will be like, yeah, we'll be like the movie where everyone will be talking, no one see. Uh, yeah, what I was saying? Yeah, two important things. One is like maybe today I'll complete, I mean, first hour I'll complete class 8. Okay. And next 1 hour, I'll be discussing on, I mean, about the internal audit, how to conduct, how to manage the internal audit. And you have to excuse me, I may not know, but I'll let you know tomorrow morning whether I'll be taking class tomorrow evening or not. Uh, if everything goes well as per the timelines, I may take. It's not a very serious thing or important thing that I need to attend, but since my son has already booked a ticket, for meeting one of the greatest footballer of all times, Leon Messi. So tomorrow afternoon we are traveling to see him, meet him, take few photos. How many of you know Leon Messi?
My son is also fan of him, sir.
That's all. Yeah, my son is a big fan of him and football, so we booked tickets. Tomorrow is coming. Is one of the, I mean, it is called Go Tour, like greatest of all times. The abbreviation of GOAT is greatest of all times.
Yeah, yes, sir.
Yeah, so he's in Hyderabad. I mean, he's coming to Hyderabad. So we booked tickets long back, very costly. And so I thought tomorrow I'll spare some time with my son to see him and have few things. Okay. So what I was telling is like regarding the internal audit. Okay. Madhusri left. No, once all of them join, I'll tell about the internal audits, but because yeah, let others also join. Someone check out with yeah, she's there.
She back. Yeah.
Yeah, all of you guys are back on time. Even Madhusri will live for 100 years.
So sorry, sir. Some internet issue. So got disconnected.
Yeah, it's there. I mean, this issue will be solved by Elon Musk in Bangalore. We have to take Starlink connection. I think he's starting it in Mumbai first, then in Bangalore. So Starlink soon will be started, but it's very costly, like 8,000 per month. And installation is something like 34,000. Its one-time investment is 34,000 and monthly 8,000, but seamless. And I mean, we need to check it out. 8,000 is too much. Yeah. For the organization, it's okay, but it's for individual subscription is 8,000 per month on Starlink. I mean, that's what Elon Musk has. Yeah, he's coming to India. Yeah, what I was trying to say is, see, uh, this class, maybe in the next 1 hour, I will be closing class 8. Okay, the next 1 hour, I'll be talking on the internal audit. I mean, how to conduct internal audit. I'll share some documents on uh, what you call the process or the procedure, how to conduct internal audit. I'll share some internal audit checklists. I'll give you some guidelines how to conduct internal audits. Of course, I'll speak on them. Okay. Uh, and as I said, tomorrow I'm not sure whether I'll be taking class. If I take class, we'll close about discussion on the internal audits. Okay. And next Saturday, next Friday and Saturday, we'll, of course, on next Friday, we'll also discuss on internal audits. But on Saturday, I want to, I mean, conduct an exam on internal auditor certification training program. So on Saturday, it will be just MCQs of which will be around 30. Okay, and half an hour time. So you need to, I'll share the Google link on Saturday, I mean during the exam time. So you need to work on that and complete it within 30 minutes and submit it back to me. So on Sunday or Monday, you need to score 70% on that. Okay, once you see, I have discussed everything almost like the last 10 sessions is almost 40 hours we discussed on ISO 13485. Okay. Basically, for internal audit training, it will be only 24 hours. Okay, 3 days, 8 hours. So it 24 hours. But we have taken more time because I was talking more on the practical things, practical approaches. I was also discussing some of the non-compliances. Okay, and of course we deviated a lot, but it is important that we deviated a lot to have a real world understanding, practical approach, than just reading the clause and trying to remember or memorize it. Okay, the practical understanding on that is very important, and this is what will help you because you are already there in 13485, which we discussed for last 10 sessions. Of course. 9.5, 9 sessions, something like. So it's a good time that I can award you from my organization, internal auditor, as a competent internal auditor, after attending so much of training for 40 hours and after clearing the exam. I know most of you will clear it, but those who are not regularly present, I think most of them who are not present, one section of them are basically from regulatory affairs. Okay, I know a lot of them like Anjali or Dolly Singh, some seniors like Anusha, and there are a lot of people like one of them is CEO Samraj, who is whom I am a consultant to their company. So some of them we can ask them to write the exam directly. But I'll tell you how to attempt that, how to proceed regarding the exams. Okay. But I want everyone to, it's not question of 70%. I want you to answer everything correctly, rightly. Which I might share a model question paper maybe tomorrow or late night today. But on Saturday evening, we'll be having this is fixed. Okay. Saturday evening, after due discussions, we'll have somewhere around 8:30 or 8 o'clock. Sorry, 8 o'clock we'll have it. You need to close the exam at 8:30. Okay. It will be in Google Forms, multiple choice. You can submit it 8:30 or if you need 10-15 minutes. So that I can on Monday or Tuesday, I can share with you the certifications. Okay. Certificates for internal audit. As I said, no, you will be getting 3 certificates. Of course, we have a long way to go. So one is on the internal audit certification I'll provide. Second thing is on the capstone project completion with certificate for capstone project completion and with a publication. I already shared some topics on capstone project which you can choose, or if you have any topics where you are interested, that also will be fine. And the other thing is like that's on one capstone will be having certification plus I'll make sure you'll get the publication. And also said like if you want to work individually doing a capstone project where I'll be doing all the mentoring with Priyanka, there is one working with Salvation Global with me. She could also, she's good in clinicals, she can help you, or I will totally keep monitoring you on the capstone project. Okay, because we need to make sure that it goes to the publication. I mean, in a very good journal. And the other thing is, like, as I said, if you are interested individually working on a capstone project, that's fine. And you have the flexibility also. I mean, two people or two, three people can form a group and work on the capstone. So I have given some topics which are at very high end. As I said, like before the capstone, I'll be speaking on two important things, perhaps for two sessions. One on the, as I said, one on how to work on the capstone project. Okay, I'll give you the total protocol. And the second is I'll take a class on AML, basic AML, how not in depth that not to confuse you, but at your level of understanding how this will be used in medical devices. Okay, in our domain, medical devices domain, how we can use AIML in very simple uh, of course, wherever it is necessary, I'll go a bit pragmatic in depth. But I'll make you, I'm pretty sure and confident that I'll make you understand that. Okay, on AML, okay, and one is on how to go ahead with capstone project. Of course, I'll be there 24/7 guiding you on capstone project. Whenever you have a doubt, you can call me or text me. And the third important thing is I want you to be, see why we call this advanced QARA, and basically for me it's a prestigious issue. When you guys, okay, clear these sessions and come out, okay, I want you to be a bit more advanced than what others are. So in that sense, I want you to learn or practically implement some of the things in your organization which I'll be guiding you. Okay, and show up in your organization that this is what we learned. It's not like what Sumant is 2 months back is the same after another 3 months. Okay, after 2 months or 3 months, there should be some difference in you in your approach of how you handle your work. Okay, it's not only important for me. I'll take it very prestigiously at a very high level that any one of my participants or students doesn't do well. I feel really bad and it impacts. Of course, it may not impact my career, but I'll be a bit low and I'll go down. Okay. So Saturday evening, you will be attempting or writing the ASO 13485 2016 internal auditor examination. And what if you have any doubts, you can share with me on Friday, next Friday, or in between the week. Any documents you want, I'll be sharing all that stuff. Okay. And one document after, sorry, evening I shared is very important. There will be one question. That is the standard document for auditing management systems. Okay, that is ISO 19011 2018. Okay, that is the basic thing for how you do the auditing, not only in 13485, all management systems, how you will audit it. Okay. Of course, I'll speak on that. It's a very big document. We can't cover it, but it's a document which will also speak something on medical devices, how you need to audit it. And that is the latest one. 2018 is the latest one. After that, there were no revisions that have come in. That I'll speak in summary, but I'll be speaking in depth of how you need to conduct internal audit. Okay. Second is how you need to do the gradings or the what is the background or what is the logic behind providing NCs. Okay, once you provide the NCs, I mean, how you need to close it. And the most important point is what are the uh, personal attributes or something like HR things internal auditor should have as an individual. Okay, you may have knowledge on ISO 13485, you may have knowledge on your QMS systems, how it is working in your organization. But end of the day, I mean, you need to have your personality set up. Okay, like you should be a real internal auditor, not compromising on any of the things. It's good for the organization if you work on it. There are a lot of things which I'll run through, or I'll some points where I'll go deep. Okay, and because like I said now, uh, later you should uh, if not with salvation, later at some point you should also, I mean, get training on lead auditor. I'll tell you what is the difference between internal auditor and lead auditor. So at some point after doing some internal audits for a year, you'll get a very good idea like how the system works and all this stuff. Then you can go with lead auditor training, maybe with Salvation Global or any other organization you can go. Okay. And secondly, I said like I'm going to take some classes. I mean, probably in January. I'll announce that before Christmas, but it will start in January. Basically, more advanced at a very advanced level. Okay. Uh, on what will be happening in next 1 2 years in medical devices, that I'll be training you or training some other part. You can participate or based on your schedules. But for them who are participating, I will be talking on more advanced technology that will be there in next 1 year or 2 years in all medical device organizations, which are mandatory that we need to adopt that. Okay, and it will be on selected topics of 10 topics. Okay, and that will be for 3 hours only per week. I'm planning it to be having it on Wednesday, but don't get mixed up. You, it's not mandatory that you have to attend, but if you can attend, that's fine. Because for you, I'll give you, I mean, something like I haven't decided how much should be the registration fee, all that, but I'll give you something like more free of attending because I'll be talking on very high-end discussions, which will be very useful for those. I mean, you should be what I feel like skilled and talent ready for what is going to happen in next 1 2 years. Okay, of course, this is what we are understanding on the basic concepts. So the next, I mean, basic and more advanced concept, but we need to still jump a step higher. Okay, so that, I mean, it should be like, you should be the advocate or you should be the leader who can understand a lot of things in your organization. Perhaps I know most of you are youngsters and juniors, but at some point you should be able to lead your teams. Okay, this is what I want to talk. Do you have any doubts, Vaibhav? Vaibhav, as you said, I'm complying to your requirement, and if you have any questions, even Akanksha, because I know like you're very interested in doing the internal audits, all that stuff in your organization. So I pray and wish you best that you'll become good internal auditors in future. Okay. Yeah. So I mean, as we move further, I said like most of you or some of you, which way should I put? Some of you have attended the, I mean, last Tuesday session on the important clause 8, and we had a discussion very elaborately on clause 8.1, that is on general requirements on documentation and what are the important things that will be discussed. I said there will be like 6 or 7 important documents that will give, or sorry, important records that will give us the inputs. Okay. Whether you are, I told you very categorically, you are measuring, okay, either you are monitoring, you will have data. Okay, data can come from any source, from your QC or from any of the records you pick up from your company, you have the data. And I told you very clearly without ambiguity that a data that's stored in your racks or in your retaining them in your almaras is something like it's worse than keeping them in a dustbin. Okay, you can throw it away. So any data which comes, the person who has an appetite to understand the data, or a person who is intelligent, okay, what he does is he analyzes the data. Data collection is very simple. Of course, some of the data is very difficult to collect. I mean, not in QMS, data from other sources. But for a QMS, you can have, because you are retaining records for almost 10 years or 5 years, you can just open up the room locker and pull out all the data, what you require. And you have to do the analysis that we discussed. Okay. And after doing the analysis, that further will help you in improving your system. It doesn't end there. See, monitoring and measurement doesn't end there. Monitoring and measurement, it will give you a lot of data. And I said very, very importantly, specifically, if your data is not analyzed, it is something like, I mean, a waste paper that you can sell it out. Okay, at least your company will get some money. And once you analyze, you'll get a lot of information. I enjoy analyzing the data, which uses a lot of information inputs, okay, whether positive or negative. You can pick up any of the data that is available, but you should know what analysis you are doing, that also I discussed. And after doing analysis, how it helps us, how it helps the organization. Okay, it helps the organization in further improvement, or if there are any data that is not, which has non-compliances, okay, then we'll do a COPPA, and further it will help the company to have a continual growth. Okay, for startups, it should be a continuous growth, or for already established organizations, there should be a continual growth. I told you the difference between the two, continuous and continual. Okay, and this will shape up the company in the future direction which, okay, the management want to see, and you should play a critical role. Okay, as a QARA guy in your organization, you should play a critical role in the improvements that should happen in your QMS or in your company. Okay, for the improvement of the company or for the continual growth of the company. Then only you will remain as an, I don't want to use something like 5-star or 7-star, you will have an importance position, or you will be recognized in your organization. Okay, and today now you tell me what are the basic inputs which we collect to understand the health of the QMS or health of the ISO 13485 QMS in your organization. tell me what are the data, what are the documents we could analyze? Where from we get all this data inputs to understand the health of the organization? I told you last week, like, what are the data points which you need to collect? Okay, it could be proactive or reactive. Okay, what are the proactive points which will collect? Majid, can you tell me what are the data which you collect from an organization to review, to analyze the data? Okay, that will help you in growth of the company. Okay, I'll put the question in a different way. Okay, what are the critical documents? Okay, where you'll have non-compliances and compliances written and documented.
The first question that you asked, maybe the PMS data we need to collect.
Yeah, that's very important data. PMS includes, like, say, as I said, it includes customer feedback. Okay, of course, the PMCF data. If you have an PSU or periodic safety update report, of course, it's a part of PMS that you can collect. And the most important thing is the complaint handling. Okay, how many complaints you got? And the the fifth one is the trend analysis that's happening with your complaints over last 3 years or 5 years. Actually, I told you when these two guys are not there, Somnath and Sumant and Madhu, I studied about their trend analysis on what their complaints are. I don't want to reveal, but you can find in the Mode site, it's a public domain. It's not that I need to creep into or scroll into some company to get the data. Of late, all complaints in the form of adverse events or serious adverse events or some field safety corrective actions, all of them are available, okay, as data in some databases. Like in mode ESFDA mode, you'll get in UMDR, you'll get in Udamid. Okay, that's European database for medical devices. So you can just Google in and get the data of any company, and you can compare that patterns. Okay, what are the complaints they have with what are the complaints your organization is having. Okay, it's always better to compare with your competitor, like how we are moving with them, why they are much bigger than us, or why why our organization is doing better than the other, or vice versa. Okay, it really helps you to understand when you are neck to neck with a competitor, you have to be very intelligent and clear on your thoughts, like what others are doing, what my company is doing, what better I can do than them. Okay. That's what I discussed last time. Like, it's not only the PMS data. Okay, you have data from your, first thing is from your internal audits, you'll get the data. What are the non-compliances? Okay, you collect the data of last 3 years or 4 years of your internal audits. Okay, you have some non-compliances. Okay, you look at the pattern of non-compliances of last 4-5 years, department-wise or class-wise, however you want to do. You will find some points where there will be more non-compliances in a particular department or in a particular process. Okay, that's what you need to pull up the data, and you may get 100 points or 100 data points or 150. It depends upon how much data you have, 200 points. Then you need to find an analogy and pull them and see like which process is having more non-compliances, okay, which department is having, or you can pull up data of some QC data, okay. Look at the rejection data of your company of last 2 years or 3 years, and then organize it, look into the different patterns, like what is the one or two or top 5 parameters which are making my products rejected. Okay, and when you compare them, there will be one or two which will be highlighted, where you need to raise a red flag saying that these two parameters contributed for almost 30% of the rejections. And I said like 30% rejections into cost of the device will give you how much money you lost, how much money the organization lost. If your rejection is high, it will run in crores. Okay, then you need to do a root cause analysis, like why that rejection is high. At least first you need to do a data analysis, like why the rejection is high, and then later, I mean, looking at a very microscopic or a granular level. Okay, why this has happened and why it is repeating. I'm just talking about your internal audit reports, or you can pull out QC data. There is a lot of data, as Mazdi said. You can pull out your PMS data, complaint data. It gives a lot of inputs. Okay, you can look at your management review meeting data. You can pull out external, lead auditors data or external auditors data. You can look at your production data. Okay, any clause, from clause 4 to clause 8, you can pull out any data and look at the patterns and see how your company's health is. Okay, is it moving in a proper way? Are there positive developments, or is it going back? Okay, or otherwise one step forward and 4 steps backward. Okay, this is what clause 8 talks about. Okay, if you read total clause 8, this is what it tells about. And once you look at the patterns of your data, analyze the data, that you need to again bring in back and work on how you can do improvements of the company. Okay, whether it's process or it's a product. Okay, but these two will be talking more categorical. So what will be your inputs? I said there will be 6 inputs that gives you a lot of data and which will be very critical. Can somebody tell to me what are the, of course, PMS is one. In PMS also you have a lot of other subsections, like I said, customer feedbacks, PMCF data, complaints. Okay. And also we have trend analysis, which we do with our customers. Okay. And CAPA also is a part of complaint handling. And of course, I said the other day, like customer feedbacks are very proactive approach of doing that before the event occurs. Okay, before the complaint comes, we do a customer feedback for a proactive approach for prevention of that, okay, adverse event not to happen. What is complaint? Okay, you need to understand these two words, proactive approach and reactive approach. Proactive is which we voluntarily go to the customer and get the customer feedbacks. Okay, he will enlighten us where we are weak and where we are strong. So in the areas where we are weak, we need to work on that. Okay, so that there won't be any further complaints. I'll tell you also on some of the things. If you look at the QC or your production data, I can predict, okay, with 99.9% accuracy in next 1-2 years, what will be your complaints? Okay, if I do an total, last 1-2 years data of your production or QC or some of the data from your audit, internal audit. So what I'm trying to say is, it's not like we are just being satisfied to understand, okay, clause 8 as an tool of monitoring, measurement, analysis of data, but also on the improvement of our QMS. And I mean, this is what the clause 8 says. But as we move further in a more advanced fashion, we should be able to look forward and predict that these are the complaints that could happen in the future. And hence I need to take a CAPA or corrective action now itself. Okay, how you do that is what we call, I said, it's more a predictive analytics. We are going to predict it. Okay, after seeing all the trends of the data, what you have collected, we'll see something that's going to have, foresee something that's going to happen in future. And hence what we do is, okay, much before that we'll take an corrective action. It's not that after the event happened or after the complaint happened, you take an action, correct CAPA, okay, it's fine. You will stop the reoccurrence of the adverse event or the field safety corrective action, but it will be something great if you can stop something, an adverse event that's happening in the future much before looking at your data analysis, trend analysis, and more predictive analytics, and stop it here. Okay, this is going to be the new order of the day. How ISO 13485 will be used on predictive analytics. Okay, that's why I said we need to look at a much higher side, at a higher angle, okay, to understand some of the things. So this is what I covered, but however, I mean, repeated this as I understand, and I told you very much like this is a very important clause for the improvement of the health of the QMS, which otherwise I told you like everything. I mean, Arulmati and myself know, if you don't follow QMS, what will happen to organizations? Okay, they will scramble and they have to quit. Okay, so I'll just run through it. However, I discussed the other day, I will run through it for the sake of those, for benefit of those who were absent the other day. On clause 8.2, because most of the things I discussed in clause 1 only on the general requirement. So here, as I said, first one, okay, basically clause 8.2 is about monitoring and measurement. Of course, after monitoring and measurement, you will have the data analysis. Okay, that was it follows. After data analysis, you will have another clause, subclause called improvement. So if you sequentially look it, you will have monitoring, measurement, and you will get a lot of records data. Then you will do the data analysis, and then that data should be helpful for you for the improvement of the QMS. So first is the customer feedback, which we discussed in length. Okay, I shared some of the documents also. Okay, this customer feedback, I say it's a very proactive approach of getting the data, and you need to get 5% of the devices you sold to get, I mean, 5% of customer feedbacks you need to get for the devices you sold. And this helps you for a proactive approach, mainly in the preventive action. That is first one. Then the second is complaints. This is a reactive approach. After an event happened, after some complaint arises as an adverse event or serious or serious field safety corrective action, then we will react. Okay. And I told you total complaint handling procedure, how to start it. Okay. And most importantly, I said how to document the complaint handling. So what is the narrative you need to write? and what are the documents you need to collect. Okay, and then you need to finalize whether it is really a complaint or misuse of the user. Okay, if it's still misuse of the user, also still you need to work on it. And the other important thing, as I said, is 8.2.1 is on customer feedback, 8.2.2 is on complaint handling. Okay, for this you'll use COPPA for investigating. Okay, I'll tell you COPPA, like separately I'll tell you. There are 3 ways you can do, sorry, not on COPPA, on the root cause analysis. How you investigate the complaints. There are basically 3 rules where you can analyze the complaint. Okay, do a root cause analysis to come out with a solution that here lies the problem for the complaint. Okay. And as soon as you receive the complaint, you need to inform this, you have an adverse event or an complaint, to whom you will report. Whenever there is a complaint in your organization, to whom you will report. Okay, you need to report to the regulatory authorities of that particular country that I have this adverse event. Okay, and all of the regulatory authorities of that particular country have an online portal or database. Okay, where you can, it's a matter of 10-15 minutes job. Just open the site, online portal, then lodge your complaint or adverse event that has occurred. Okay, this is mandatory. And if it is a very serious, every country has some timelines to report to the regulatory authority. If you miss the timelines to report to the regulatory authority, then there will be serious consequences. Okay, like there is a chance that your certification may be on hold, or if you are causing more serious public threats or public health hazards, okay, your production may be stopped. So it's important, like I said, again, every complaint, every regulatory authority of that particular country gives some time frame. Suppose if you look at time frame of Europe, okay, in EMDR, they give you for any adverse event that causes serious public threat within 24 hours, you need to open the portal and lodge the complaint or the adverse event. Suppose if it is an adverse event, okay, not causing so much of public hazard or public risk. If it is an adverse event, they'll give you 1 week. Okay, if it is a non-serious, they will give you 24 days. But however, the most, what we call the important gold mark, or what we call the standard is you need to report to the authorities as soon as you get the complaint. It is important, but before reporting to the authority, regulatory authority, you need to work on in a very quick time, work on whether it is a complaint related to your device or related to the misuse of the device, or is something linked with the doctor, with the physician, with the patient and the device. As I said, there will be a triangle thing. When there is a triangular ambiguity between the patient, okay, the physician and the device, the risk will be escalated. I said what we call it more a synergic effect. 1 + 1 will become 3 or more than 3 or 4 or 5. Okay. I told you, like, if there is a patient who has a compromised anatomy, or is it in very risk of grade 3 diseases, and the doctor is not new, okay, maybe he has some horse surgeon training and all that stuff, but is new, and your device also has some risk carrying with it. but it is an acceptable risk, but still it is carrying risk. So when these three accumulate together, obviously it will erupt as an big complaint. So we need to look at all possible angles, like, is it my device alone causing, or is it any other devices that are used with my device, compatible devices, that is causing the issue, or any role of misuse, or any role of the patient in this? Because a lot of chronic ill patients, there will be some devices which obviously will fail. Okay. And we also advocate not to use in such kind of patients in our IFU. Okay, what we call contraindications or warnings or precautions. But I know, like, nobody reads the IFU. So complaint investigation is such an important thing. I don't know how many of you love to do that, but I enjoy doing complaint investigation. Okay, of course, I don't do it in such a depth like CBI or NAI, like what they have done in Delhi Blast, Delhi Red Fort Blast. But it will be very interesting to do root cause analysis and to understand the complaint. So immediately once, the one I told you is customer feedback. Second thing is on complaint. The third is immediately get the complaint, report to the regulatory authorities based on their time frame of reporting. Okay, don't report as and when you want or after 2 months or 3 months. Okay, it is important. Actually, this culture is there in very good countries, because why we need to report? Can somebody tell me why we need to report the adverse events or serious adverse events within a quick time? What is the reason? If I don't report, what will happen?
To avoid public threats.
Yeah, Akanksha, repeat.
To avoid any public threats.
Yeah, it's not only, yeah, that's a good answer. It's not only public threat, that this kind of incident may not happen to the second patient or the third patient. Okay, you will be avoiding. Once you report this to the regulatory bodies, they will become vigilant and they track your devices. Of course, the company will also track the devices and see that this incident has happened. So they will be careful. Okay, when they try to use your device in the second or third patient, because there is already one patient who has morbidity or who has which cause catastrophic event or death. Okay, so it is very important. I mean, because we as consumers of lot of products. I mean, I'm talking about other retail things and others also. Never we use the consumer portals or our portals like medical device portals, where never ever we complain. Okay, we take everything as it comes. That's the problem with the mindset. Okay, if you look at the Western countries or the US countries, they have the habit of reporting everything when there is some catastrophic event or anything that is causes severity or is at risk, so that it will help other persons, okay, not to undergo the same problem. Of late, India, Cedisco Metro Vigilance, okay, Metro Vigilance population of India also has launched. This is Metro Vigilance Program of India, where you can submit your adverse events in this portal. This is MVPI, opened by Cedisco. You can report to your medical device adverse events reports. Okay, happens with the company, or the hospital can also keep reporting. If there is any serious issues on the field safety, corrective actions that cannot be resolved and that has led to a serious health issue, that can also be reported. Okay, the third point is reporting to regulatory authorities. I mean, in clause 8.2, in clause 8.2, the fourth thing is the internal audits. This I said is very, very important. Of course, I'll be discussing in length on the internal audits. Okay, why internal audits talks lot of bitter truth. It's a truth, but sometimes it will be bitter. Okay, it won't be a sweet, so sweet like honey. It will be a bitter truth that you'll find a lot of NCs in your own organization, in your own department, or a department where you are linked, okay, or department where your friend is working. Because in internal audits, you can't audit your own department. That's a gold standard rule. Nobody is allowed to audit their own department. So basically, you will be auditing the other departments. And I'll tell you what we call the ethical and moral issues in internal audits. Okay, you should not hide because that is something related to the department where I am close, and all this stuff should not come in. Then only the internal audits will be, more ethical and more useful for the improvement of the organization. When it's like internally you are trying to check what are the things that are non-compliant to your organization. So raise an issue, raise an NC, issue a CAPA. Okay, so that will be closed. If you keep it open, then see if there are NCs open, you know it that is a non-compliance, and still you don't speak and keep your mouth closed. So what happens? It's like that will cause a lot of bleeding of that process, or NC, that NC causes a lot of bleeding. Okay, then you need to go for ICU, and ultimately it will result in a major or critical non-conformity. Okay, that results in the death of the patient or compromise with patient safety and health. Okay, because end of the day we are more patient centric. Getting my point. See, if there are some, when I talk about the internal audit, I'll tell you, even the observations, even what we call opportunity for improvements, or the minor NCs, if the major NCs, if they are not closed or corrected, okay, they escalate into big NCs or big issues that happens in your company, whether it's in your process or in your product. And I have seen it myself literally when I am the head of QC. Okay, where some which we take very casually explodes. Okay, it may not take much time, after 6 months or 1 year, it explodes and come out as a complaint. Okay, and complaints will give a very bad name to the organization and affects the business of the company. Okay, and you yourself consciously knows that that is an NC, but you have not reported it or not worked on that NC because you are timid enough, or you are afraid, or you are favored somebody, or not to have NCs, or you are biased because somebody is your friend. So internal audits, which I'll be speaking a lot on this. Okay. So this fourth is the internal audit. I'll talk on this very clearly because this is the one which really pokes deep into the organization structure, process, product, and can really help you, okay, to understand what's going wrong, what is good, what are the NCs, what are the compliances. Of course, if you have more compliances, good. You should appreciate that. If you have non-compliance, how to react to that. Yeah, this is something on, say, I told you 4 things. Can somebody recollect to me? Oh, I have a very short memory. Someone can tell me What are the 4 things which I told you in 8.2? What is 8.2.1? No, just now I told like it's. I think you guys all are looking at somewhere or listening to music, just keeping keeping the Zoom link on. What is the first one? I said first is the customer feedback, which is a proactive one. The second is the complaint handling.
Complaint handling and PMS, sir.
Yeah, complaint handling and PMS. And the third thing is reporting to
Serious
regulatory authorities. And the fourth thing is internal audits. Okay, you need to conduct your internal audits periodically. I'll speak on that in detail. And the fifth one is monitoring and measurement of your processes. There will be a lot of processes that will be happening in your organization. Okay, it could be from design you can take, there will be a lot of design and development process that happens, verification or validation processes that happens to your devices. Okay, how you are monitoring and measuring them? Okay, are they documented? If they are documented, okay, where is the document available? If the document is available in the form of a record or a design history file, can you access that and take out the data? Okay. So it could be any process. I said, like even in purchasing process, you'll have a lot of things on supplier evaluation or supplier selection. When you come to production, there are a lot of processes in QC processes, QA processes. You take from class 4 to class 8, there will be a lot of processes that happen, but how you are monitoring and measuring it. And I told you very categorically last time, when you monitor something, okay, you should be able to, I mean, when you are monitoring and measuring something, you should be able to have some quantifiable data. Okay, data should be quantified. It can't be in a vague words or sentences. Okay, and I also told you, okay, and I also told you, wherever it is not able to quantify, okay, there will be some areas where you can't quantify the data, so you have to give them numerical grading. I told, for example, in customer feedbacks, okay, you can give a numerical grading saying from good, best, better, okay, or worse. So give a grading of 1, 2, 3, 4, 5 on a scale of 5 or on a scale of 10. Try the best to convert your total data into, I mean, whatever is in a, I told you, qualitative data. Okay, you'll get data in 2 forms. One is quantitative, which is measurable. The other is qualitative, which can't measure. For that, you need to convert it into a qualitative data, into a quantitative data where you can give the gradings. Okay. I'll share one example on that, how you can do the gradings, and still you can work on that. So what this clause specifically is talking is for monitoring and as an appropriate measurement of the QMS process to demonstrate the ability of this process to achieve the planned results. Okay. What you are doing is like you have some acceptance criteria or planned results. That's why I said planning is very important. While planning only, you will have some criteria that these are my acceptance criteria or these are my expected results which I am planning. Okay, you have them in the form of technical specification sheets or in your SOPs or in your S3Ps. Okay, take example of a clean room. You will have a monitoring system of humidity, temperature, particulate count, bioburden, all that. For that, you have, okay, set criteria that this should be my limits. Okay, my temperature should be at 25 to 28 degrees with rain, with that deviation. And my humidity, okay, should be around 50%, or some clean rooms it could be 75%. Okay, my bioburden should be below 10 CFU. Okay, product bioburden, or you can talk on product bioburden and clean room bioburden. Then what is your particulate count? It again depends upon the clean room. Class 100, it should be less than, okay, less than 10 particles per square feet. So you have a accepted criteria, a criteria where you already define it during your planning. So you should be, your monitoring should be in such a way that you meet that criteria. If you are not meeting your acceptance criteria, you need to look at why you are deviating from that criteria, or why your process or products are becoming non-conformities. Okay, this is quite important. Why I'm telling this is quite important is like, when you have a set criteria, set process, if it is not, if you are not able to comply with the set process and set results, whatever you call it, the acceptance criteria or your set specifications, set monitoring conditions, okay, it's all there in your QMS, it's there in your system. It's not that every day you are rewriting it. Okay, there are established standards. From that standards, you are picking up this data, whatever is accepted. So for clean rooms, you have ISO 1107. For everything, there is a standard how to maintain a clean room. So what is the criteria on your bioburden or particulate count, humidity, temperature? Suppose you are doing some device, you have technical specifications for some device. It will have a standard. It will set a criteria like what is acceptable, what is not acceptable. Based on that, you'll prepare your SOP, and based on that, you'll get your technical specification. Of course, you'll also get technical specification from your R&D. Okay, what has to be accepted, not accepted. Then if you are not meeting them, see, my point here is, I don't want to demonstrate the ability of the process to achieve the planned results. See, you may think I am crazy, but I don't have any issues. Okay, I always think on the other side, okay, what's other side of the door, like other side, I don't call it negative thinking, but thinking more ahead, like if I am not reaching planned results, UMS says that your process must demonstrate the ability to achieve the planned results. But my question is, when a planned results are not achieved, okay, if you are not able to achieve planned results, what you will do? If you raise an NC, okay, this is something which you need to logically think. It's not somebody will tell you. It's more of a common sense that, yeah, the QMS or the clause says that you need to meet this. Suppose I am not meeting that, what should I do? Is the next question. That's what we call 5 why. You need to ask 5 times why. Okay, that is one of the root cause analysis. Okay, which is 5 why, that came from the company Toyota, I told you. Okay, if they have any problem, they ask 5 times. Like, it will be interesting to understand, I mean, to ask 5 times why, and at the end you'll end to a conclusion where the problem is. Okay, of course we'll issue NCs on that, and we'll do corrective actions. And after doing corrective actions also, still you are not achieving the accepted criteria, what you'll do? Expect somebody to answer that. You have done a CAPA, you have done correction, corrective action, preventive action, you have taken everything. What is based on your root cause analysis? Okay, and you thought that your root cause analysis is right, and you have addressed, you thought that you have addressed or come to the point that you have addressed the issue. Okay, why you have non-compliance or not meeting the plant results or not meeting the acceptance criteria, and you have taken an action, that is COPPA. But still you are not able to meet or achieve the planned results. I mean, my direct question is something. If you have done a COPPA with a proper root cause analysis, okay, will there be still complaints or adverse events or non-compliances that can happen?
We need to do again the
What, Vaibhav?
we need to do again the process.
Yeah, it can happen. Sometimes your COPPA may not be effective, what we call verification of effectiveness of COPPA. And why it happens is, okay, there is something which you have not viewed under your purview of the root cause analysis. Okay. Something which is not, I mean, which is overlooked or which you have not taken into consideration as a risk. So there will be 2-3 factors that either you need to go back to the design and drawing, the design and development and change your designs, or you need to look at other risk factors that are contributing for your NCs. Okay. Or you need to go back into the market and look at the trend analysis, whether this is a new complaint or an adverse event that never ever occurred with any device and it's hopefully happening with my device. Okay, these kind of things also will happen. So this is on the process which you need to do. Okay, for you as an auditor, you can select a QMS process, training, document, or production. I said, look at the process. Okay. Basically, I told you, like, every department will have a quality objectives. If somebody is not able to achieve the quality objectives, okay, suppose my plant production is so and so units, in percentage, I could say I should achieve 95% of my production. Vice versa, is say 5% of rejections, but I'm not able to achieve 95%. That is my plant result in KPI. Because that's a key performance indicator, but you're not able to achieve, then what could be the reason why I'm not able to achieve has to be interrogated. So you need to look into all these indicators, performance indicators, non-compliances in all the processes. Okay, as an auditor, and see, as an auditor, you should not, I mean, I'll tell you during the internal auditor training, you should not give suggestions or leads, okay, how to address the COPPA. Okay, it is up to the employee to address the COPPA. Don't give leads or suggestions to other guys that, okay, you do this root cause analysis and close COPPA. That is against the ethics of an internal auditor. Should not provide any guidance or suggestions to the auditees. Okay. But you have to name them. I mean, you need to raise an NC because this process has happened. Why you have not met the results? Because these are planned results. Okay, suppose there is 5% rejection. And the KPI is that you are going to reach 2% rejection, but still you are going at a 5% rejection this year. And what could be the issue that you are not able to reach 2% and your rejection rate is high like 5%. So these are some areas where you can draw your NCs. Okay. See, one is monitoring and measurement of the process. Any process you take, how it is measured and monitored. Okay, suppose I will take purchasing process. How you are monitoring that? Okay, in purchasing we discuss like there will be a supplier evaluation. Okay, selection of the supplier. We do supplier before selecting the supplier. We do supplier evaluation. After supplier evaluation, we do the supplier verification or verification of the product raw material what is providing, and we do an audit of the supplier. Then we have the supplier agreements, okay, which is very, very important. And after all these processes, then we'll procure the material. So we will frequently re-audit the supplier that whether is producing consistent material to us as per our specifications. Of course, we do the raw material verification what he has provided to us. But it becomes sometimes very important that you need to do cross-check. Okay, do a cross-check of what is really happening. Right? It's not like we are trying to find a fault with the supplier, but we are trying to have what we call supplier control. The organization should have controls on the suppliers. I told you many times this word control is very, very important. Okay, mainly for the outsourced activities, you should have a control on your sterilization. You should have a control on your supplier of raw material. You should have a control on your design and development if he's providing you the designs. You should have a control on your uh, clinical validations or biocompatibility studies which are done by the third party or your outsourcing. You should have control on your calibrations which are done by the third party. This all we have discussed. Okay, these processes you should have a control. Okay, then when we come to the monitoring and measurement of the product, this is the last one. So in 8.2, you have 6 subclause which are very, very important, which talks about the okay, which talks about how your QMS is functioning once you collect all this data. Customer complaint, customer feedbacks, okay, complaint handling, how you are reporting to your regulatory authorities and the trends, okay, the internal audits, monitoring and measurement of processes, monitoring and measurement of the product. Okay, there it is process, here it is product. Okay, these 6 things are very critical in giving you feedbacks of how your system is functioning. Are you getting my point? So in the product, what we'll do, we do a lot of things for our product. We have like from it's when I say product, it's not only the finished product, it could include okay, your components, your raw materials, okay. Some products that you may outsource as customer products, okay, and your online components or devices, and of course at the end of the day you'll have the finished product sterile or unsterile. Okay, with the sterile there will be still some more complications that will have or some more processes that are linked to the product. So what you need to do is you need to have monitoring and measurement of the product. At what stage you are doing, you start from your raw material. Okay, at your raw material stage, are you monitoring or measuring okay, your product? Are you verifying your raw material? If you are verifying, where is the data? Okay, And from raw material, it may come into production. Then there will be some components that are devised, then some components that will come into. There will be a multi-step process approach. So you need to understand like what are the how I am monitoring or measuring. Okay, some you may do dimensional verification, some you may do, I mean, verification based on the weight or mass of it, some on the volumes. There will be different monitoring and measuring systems for different medical devices. Okay, so the organization must monitor and measure the characteristics of the product appropriate at appropriate stages of the product realization. When I say product realization, I'm talking from design and development. Okay, till the end when your product and I mean design and development, including purchasing. Okay, till the design transfer to production, production to, I mean, the in-process QC, finished product QC, then you will have the sterilization. Okay, all these how you are, you will have a documented procedure, you will have the acceptance criteria. Based on that criteria, you will have having some records. This what we call as a documentation phase. So once you document, it becomes the records. Okay, what we'll do with the records, I told you. What we'll do with the data, I told you just half an hour before. So to verify the product meets, okay, the product requirements have been met. Again, we discussed about the process requirements are met. Here we are talking about the product requirements are met. Again, if they have not met the product requirements, then again it goes back to the loop. Okay, this is what we call basically on the conformity assessment. Okay. Evidence of conformity assessment with acceptance criteria shall be maintained. What is conformity assessment? This is already mentioned that it has to be within the acceptance criteria. Okay, when you give certificate of conformance or conformity assessment, you will give all this. This is my acceptance criteria, and these are the values or data of the particular devices or batch of devices tested. Okay, that's one point. And the other point is what are the standards you followed? Okay, in testing that. Because every every parameter that you have tested will have a standard. Okay, I'll tell you later when you don't have any standard, I mean, how you need to do that. Okay, in this. So these are 6 important points which you need to get. However, in this, I'll discuss internal audit in detail. But these are the 6 things which will give you direct inputs, okay, for the data analysis. Once you analyze the data, okay, then you'll have a scope for improvement. Of course, not only these 6, there will be some others, like I said, management review meetings or external audit reports also give you the inputs. Okay, you need to, I mean, sequentially mention what are the inputs I am getting. Okay, to look at the effectiveness of my QMS. Not only this, we talked about product measurement, monitoring measurement of product process, discussed about customer feedback, we discussed about internal audits, we discussed about complaint handling or complaints. We also discussed about regulatory, I mean, complaining to the regulatory bodies. Okay, or compliance with the regulatory bodies in reporting to regulatory bodies. Not only these 6, you can find a lot of other things which I am going to share. It could be something like 13 or 14 inputs that really gives you okay, where you can work on the data, do some analysis that gives you inputs, okay, work on your PMS. See, why I'm taking more time here is that if you have understood this clause 8 or 8.2, clause 8.1 is more general, which I already discussed. 8.2 is very, very important. If you understand this becomes easy for you, whether you are a quality person or a regulatory person, okay, to understand what are the checkpoints, okay, where you can monitor your QMS system. And there will be a lot of monitoring things that will happen. What are the checkpoints where you can just hold the product or give an NC to the product? Could be a minor, could be OFI or observation. So that, again repeating, it won't escalate further. The remaining things I already discussed, so I'll just accelerate a bit. So this is 8.3. This is what we said, like we thought, I mean, in the earlier discussion, I said like after doing kappa or a perfect root cause analysis and kappa, still if we have complaints or non-conforming products, what you will do? It is a very high level discussion. What we will be doing, though we have used all our energy, all our resources, okay, in understanding the root cause analysis, in doing the kappa, okay, but still you will have some issues with the product. Okay, it could be internally or it could be in the form of complaints, or internally it could be some non-conformity products not meeting the specification. This I said, I mean, I said it in a very skeletal way that there are some risks which are beyond your control. There are some which you have not identified, some root causes which you have either not identified risks, or either it could be a new one, okay, which no device, similar device has come out with. It could be a complaint or an adverse event where no same device has come out with in your PMS. Nobody has reported. This is the first of its kind you are reporting. Okay, if you can report such a thing also, you should feel happy, great that, okay, you have found something which nobody reported. That could happen with your device or may not happen. It could be a patient issue or it could be a physician issue. It could be an issue. Okay. But once you confirm that, okay, the product is non-conforming, what you will do with the product is clause 8.2, 8.3. What you will do with the non-conforming products? What are the different non-conforming products? Okay. Yes, this is, I mean, like very general one. You need to establish a document procedure, what you will be doing with non-conforming products. Okay. You need to have a control, identification, and documentation of all the non-conforming products in your organization, where whatever it be, it could be a raw material, it could be a component, it could be a finished product, okay, it could be a damaged product, or it could be a complaint that have come in, okay, it is a rework product, anything, what you will do with that, and why we have to do it, why we need to have a control on it, why we need to segregate it separately with a red tag and keep it in a separate room, okay, with lock and key, so that only one guy has authority to enter into the room. Okay, I'm talking of all non-conforming products, starting from the raw materials, components, finished products, anything, even your spare parts, the complaint samples, rework samples. Why they have to have control? Okay, why we need to use an identification tag that these are non-conforming products? Okay, and why you need to segregate, separate them and keep it in a lock and key? Okay, it's almost like quarantining them, like how we were in COVID time. Why it is important that you do this? Can somebody tell me why we need to? Can somebody speak? Why we have to separate, segregate, and control non-conforming products in our organization, whether it could be in purchase department or raw material, sorry, from the raw material stores, or in your production area, or in your QC area, or in the R&D, or it could be in the finished stores. Okay, even your QC samples has to be, yeah.
Yeah, there will be two reasons, sir. One is to not use the product because a non-conformity product could not be used for the manufacturing or any purpose. It may cause any issue. And second thing is it's an important thing as setting the procedures and standards of every organization as per the ISO standard process. We should not use the non-conformity product. To follow the procedure and standards, we will do that.
Yeah, you have come to the river. I mean, like you're hungry. I know, like not hungry, you're thirsty. You have come to the river to drink water, but you have not taken it. You are absolutely right up to some level. These non-conforming products, okay, I have seen personally many times. What happens is if you don't tag them, label them with red, or control them, segregate them, okay, keep them in quarantine with red, I mean, in separate room or a room with this labeled with red. Okay, I have seen it myself. Like they get mixed up with the conforming products. Okay, there will be some devices in that particular area or in that particular room, like in packing or in production room or in some area, some components, okay, they get mixed up with what they get mixed up. They get mixed up with the already accepted devices or the devices which are having compliance or met the specification. So when they get mixed up, it is very difficult to identify which is conforming and which is not conforming. Again, you need to do it all from zero. Start from morning 8 o'clock, what you have done from 8 o'clock. At 6 o'clock, evening 6 o'clock, you need to do. If any non-conforming products have mixed up with your conforming products, because everything looks identical. I mean, you just need to measure and monitor. By just looking at the device, you can't see we can't tell which is conforming and non-conforming. By default, I mean, if nobody has noticed it and it enters into the finished device, finished product, and goes to sterilization and to the market, you understand how devastation condition or how devastation it can cause, a non-conforming product can cause. Okay. Even I'm talking about even a component can cause a total disaster. I'll tell you an example. Like there was an component or what we call, which we basically use in coronary vessels, what we call it as a balloon to open up any clogged or blocked arteries. We use angioplasty. Okay, that balloon, it's basically a plastic. Okay, it can expand to a diameter of 3 mm. The maximum diameter that it can expand is up to 3 mm. If we expand that more than 3 mm, the balloon can't tolerate the backward pressure and it will burst. Okay. But we can't label it as 3 mm on the balloon because balloon is a plastic, we can't print on it. So generally we label that on the hub of the catheter. But because of the mix-ups of the hub, what happened? Okay, it could be mix-up or it could be non-conforming product that are common. The hub was labeled as 3.5. So obviously we think that the balloon can expand. Actually, the balloon expands up to 3 only. But now what we think, since the hub that is attached to the balloon catheter is 3.5, what the doctors or physicians or cardiologists will do, they think that it can expand to 3.5. Okay, this happens because of some mismatch of the component that has entered. Okay, because we have not segregated them properly, separated the non-conformity product. So the doctor starts expanding it up to 3.5. Once he crosses 3 and keeps expanding, because the balloon can tolerate a pressure of 3 only. If you keep expanding the balloon up to 3.5, what will happen? It will burst. When a balloon bursts in a coronary artery, you know what will happen. Okay, the pressure in a balloon, okay, will be something like 24 atmospheres. It's something like near to what you see in a car tire. Okay, our car tire has something, I mean, front tires, back tires are something like 24 to 36. You know, that's the pressure that you see in car tires. So at that pressure, if the balloon in the coronary artery in the heart bursts, it's evidently the patient will die. And this happened just because of the mix-up of some of the components, wherein a 3 mm balloon, which has to expand up to 3 mm, okay, once you apply pressure, it has to expand up to 3 mm, but it is labeled as 3.5 on the hub because the hub and balloon come separately. But this hub is attached to that and it causes, I can quote you hundreds of examples. If you are not able to control the non-conformity products, this happens in some organizations like the SMEs where they do all the things, okay, at one workplace. So the production will be happening, the components will come, they will be doing assembly of the components and there only they will keep doing packing. Okay, there only they will doing the QC and the testing. So if you have not segregated your, I mean, processes separately, like production in one room or components in other room, you need to have, okay, separate sections for each and every operation. These kind of things happen. When these kind of things happen, it will be very catastrophic. This is very, very important clause to me. If you are not able to control, and there are different ways to control, like you need to segregate, okay? I mean, like first you need to label it as a non-conformative product, then use an red tag, whatever red label or red tag that it is, whatever is red is non-conformity. Okay, then you need to segregate, take it out from that area where it is in the production or somewhere, whether it's in the stores. Keep it in a separate room. Okay, segregate them in a separate room. But in the separate room also, you will have a lot of other non-conformities. Okay, your QC non-conformities where component non-conformities will be there, your raw material non-conformities will be there, your complaint non-conformities or complaint devices will be there, your daily QC checking samples will be there. Okay, so there will be a lot of non-conformity products that will enter, okay, at various processes. So you need to designate, mark them, okay, and you need to document them, okay, in your logbooks, like on which date this complaint, this NCs came, what is the reason, what is the number. Because it happens, like, say, if your company has this segregated area of non-conformities, you go into that non-conformity area, check the logbook. Okay, if there is no logbook, immediately you can raise a major NC. Okay, but if there is a logbook, but there are no details available, whether it's a component or is a device, what is the date and why it is rejected, then you can raise a minor NC. Okay, because these devices, there is a scope and chance that sometimes I have seen in organization when some of the components that are very urgent are not available. I'm telling, with hands on my heart, I'm telling you, these guys, some of the guys in production, they go to this segregated room and they will look at some pieces or some components which are okay or which can conform, they pick up this, okay, and use in the regular production. This should not happen. So that's why it's advised to have lock and key and only with one person who could be an head QA, or head QA can also have this biasness. So it's all ethical. Okay, you should not do this because you are talking about patient. You are not talking about some customer who is eating chocolates. So once you confirm that it is a non-conformity product, I said you'll segregate, control, quarantine, there are a lot of things, you label them, you have an identification mark, all that stuff will happen. You have an entry log documented, fine. But you can't keep them over years. So what you will do with these non-conformity products? Okay. Okay, actions and dispositions. This is bit, if you go through this, you will have your own opinion. I have my own opinion on what you do with this. I 100% suggest that it has to be disposed outside, or generally we have, any company will have an understanding with the, what you call the environmental, or that particular city, or that particular town, municipality.
PTP.
Yeah, where they'll come and pick up your disposable surveys. It's better to dispose whatever is non-conformities, but in some cases, okay, see, non-conforming product must undergo 1 or 4 disposition options. Okay, for me, it's better to throw it out to the municipality so that it is treated as a scrap. Okay. But for some products, what happens is, like, if they are very costly devices, like class 3 high-end products, like software linked medical devices, okay, surgical implants, then you can't, of course, it is a non-conformity, but you have the options to repair and adjust them so that they come into, they can be accepted as a conformity product. Okay, one is you can do a correction, or you throw them as a scrap, discard them. The third option is you can rework on them. Okay, rework and correction are different. Rework happens when some minor things go wrong, like if the length is more, Okay, if the dimensions are more. Okay, you can rework on it to bring it into the acceptance criteria, but still I say this is a risky issue because all the rework products has to undergo the verification and validation to be accepted as conformity products or conformed products. Yes, you can do rework. I have seen a lot of places where rework has done, but these reworks will still carry some risk. That's why you need to do the risk management, do the verification of all the reverse product. And the most controversial thing for me is acceptance by concession. Can somebody tell how can we accept anything by concession? See, it is rejected. It is a non-conformity product. Under some concessions, how can I accept it? Okay, I will tell you, like, because you guys are not responding. I've seen a lot of batches who are very interactive, but you guys are just dumb, like you are not, you say something, even if it is a wrong answer also, it's fine. Acceptance or concession can be fine, but that part or parameter which you have accepted under concession, though it is out of specification, should not have any direct impact on the intended use of the device. Okay, intended use of the device, or it should not carry any risk. It could be out of specification. It could be something which is not the main component of your device. Okay, which may not have any impact on your device or direct impact on your device. Okay, I mean direct impact on your device safety and performance, and of course at the end on the intended use. For such devices, you can accept them as concession. Suppose I have some component which is attached to the main device, but it doesn't have much role. Actually, it doesn't enter into the human body. Okay, like I can quote a lot of examples where you can accept under concession. Suppose I have some sterile cotton, which could, where the observability is, say, my acceptance criteria is 20%, it is having observability of only 19% weight by volume of the blood. It's okay. It's not that the patient is going to die on a deviation of 1%. Then I have something like a hub, where there are some scratches or something that happened, but the label is visible. Only there are some scratches which are not too prone to breakage. Still, I accept them under concession. Okay. And there are some spares like that can also be accepted under concession in some software medical devices. Again, I'm coming to the point, it's not in SOMED. SOMED is something where your software is serve the intended purpose. Okay. The total software is for the intended purpose. The software is a medical device there. So it's
Sir, I got a question over here.
Yeah.
So, do we need to declare that somewhere in our documentation or in the IFU that this device is accepted under concession?
Yeah. Not in the IFU, but in your batch BMR batch manufacturing records, you need to enter that. Whether it is reworked or accepted under concession, or there are some corrections that happen. Because you should have traceability of whatever you reworked, repaired, or corrected, or accepted under concession should be recorded in your BMR. Okay, not in the IFU, all other things. But you should have a traceability on that. Okay. So this is how what we do. I mean, there are 4 5 ways what we do. You do a correction, adjustment, repair. This is made for sawmill or medical equipment. Scrap and discard. If it is of low value, it doesn't have any value. I mean, mostly we'll discard them, like mostly the plastic material and all that stuff. And there is probably you can rework again. I am repeating all this rework, concession, acceptability under concession, repair. They should not carry any risk further and affect the intended use or safety and performance of the device. So further, okay, during design and development phase only, what they do is they do the verification and validation of the reworked product accepted under concession that it is not affecting the device and corrected any corrections or repairs that happen to the device, they'll check it, verify it, validate it. Okay, it will be there in your SOP. It is a part of your SOP that you mention. Okay, these are the procedures for rework. Then only will accept. These are the procedures for acceptance under concession. These are the procedures for correction. It's not that you have an idea in mind which you, I mean, apply on the shop floor. It has to be totally, there will be an SOP for all this process, even how you are disposing the scrap. Okay, there will be an SOP and this has to be documented, which batches, how many numbers, all this stuff. Okay, and the other important thing is, okay, this, I mean, whether you do the correction, scrap or rework or acceptance by concession, I said like no, they carry the more. Of course, the risk could be acceptable, but still in a very high risk condition, high risk medical condition of the patient. Okay, there is a chance that this could fail because I have a trend analysis or I have data which were collected for one company where I found that the reworked products are not only the one, maximum like 60-70% of the complaints are from the reworked products. So I told to them, you need to either scrap them, your reworked product, don't make them conformity product, or find a new way to reduce the risk of the products. For this, I mean, risk management is important. So this, which I'm just scrolling through is of you. Okay. In this, suppose you have this and see what is the severity, supporting evidence, corresponding copper plan, like what I have shared in from class 4, no? This is for you to go through it. Okay, this I already discussed. Documentation is a clear work instructions, documentation specific rework, subject to re-verification validations, reassess the risk of the rework product. Okay, it has to be documented in the manufacturer BMR that these are the products rework. And this also could become a pattern, like I said, no? If there are more rework products in that particular batch, which means that the process, there is something wrong with the process that's happening, or there is something wrong. If you have say 30-40% products which are reworked, I think that's really stupid. And this is what is very important. Of course, we said that there is a non-conformity that is identified. Within the organization will do some reverse, scrap, repair, concession, XYZ. But if you have non-conformity after delivery, okay, you found there is non-conformity after you delivered the product into the market or while people are using it in hospitals, what you will do? Okay, this clause addresses concealed non-conformity. It's already a non-conformity concealed, but which has not become evident to us during our QC or in our finished QC or in our organization. It has not, okay, sparked out that this is a non-conformity product, but it has entered into the market. Okay, we can do a lot of investigations like why a non-conformity product entered into the market. There could be a lot of reasons. But the point here is like if a non-conformity product, okay, enters into the market, either it could be mixed up with a conformity product and entered into the market, okay, or there will be some calibration issues. Okay, there could be some calibration issues. Later you found that there is some calibration that has gone wrong, but by the time you observed it, it has entered into the market. There is some sterility issues. I said most of them don't wait for the sterility time period up to 14 days. Before 14 days only, they dispatch their products into the market. So after 14 days, when you get the sterility reports, you find them they are unsterile, but it has already entered the market. So there will be a lot of situations where the device can enter into the market. Okay, but it is a non-conformity product. Then what you are going to do? Anyone with IQ 240, like Einstein, can answer this.
So basically, the recall is the only option over here, I guess.
What?
Recall is the only option if the product is listed non-sterile in the market.
Yeah, it has entered into the market. What will do?
The recall.
Yeah, great. First, what we'll do is we'll give advisory notices, recall, field safety corrective actions. These are the things which we propose. But most important thing is we'll do the recall. I mean, most of the things happens parallelly. Okay, one group will ask the marketing group to recall. Okay, the regulatory group will complain to the regulatory bodies that these are non-conformity products that have entered as an advisory notice. Okay, like if it is an equipment, then you go or a summit, something like that. You voluntarily travel to where it is placed, and you will do some corrective actions, field safety corrective actions to mitigate the risk or to address the complaint. Okay. But this to me generally doesn't happen. But there are few cases it could when you don't have a proper QMS system. Okay, this is all about clause 8.3. We discussed about non-conformity product. Okay, if it is in the market, what you will do? Okay, why basically it enters and what you will do, whether you do a recall or give advisory notice to regulatory body or you do a field safety corrective action, it's an equipment or summit. Okay. Non-conformity products after delivery. This is non-conformity products within the organization. Okay, you can do a rework or you can, a lot of things can happen. Dispose them, scrap them. But if you identify non-conformity products, the most important thing is like you need to segregate them. Okay, label them, identify them, segregate them so that they won't get mixed up. This is clause. How to control, identify, and document non-conformity product. Have you understood 8.3. Because I'll be asking, I mean, in your exam, there will be a few questions in this. There will be a question like, what is a repair and rework? What is repair and rework? Same or different? There will be questions like this, like what is exclusive, what is not applicable, what is verification, what is validation. Okay, a few questions like that. It's like an open book exam, you can see it.
So repair and rework are generally different, I guess.
Yeah, they are different.
So repair basically means that you are making the device conforming to the intended use. But rework is basically you are you know, refurbishing kind of the entire device is making new. I don't know how to put that in word, but I guess you got my point.
Yeah, see,
Like in rework, you meet the full specification of the original product, but in repair, you are basically making the product useful to serve its intended use.
yeah, I'll tell you, but yeah, give me, shall we continue for another 10 minutes? Or shall we close it so that tomorrow I'll talk on, up to here we have completed the ISO 13485 clause 8. There is one point which I'll discuss on improvement after I talk to you on analysis of data. So we can directly enter into one, internal auditor training. So what I'll do is, because you join late, I need to take, you join late, but let me close it. It's winter, no? Okay, I'll close it for today. And I'll tell you tomorrow morning whether we'll have class in the evening, Saturday evening or not. But morning 8 o'clock or 9 o'clock, I'll have my schedule sorted out. If I'm not going to that event, I'll take class. If I'm going, then I'll let you know. Okay, guys. If you have any questions, but as I said, no, I'll be posting a lot of documents on the internal auditing. Okay, if you understand, go through them. If you understand, it's good. If you don't understand, anyway, in next class, I'll be discussing about that. Okay, on how to do internal auditing. But I'm telling you, whatever it may happen, whether the earth may break or the heaven may fall or the sky may fall, we are going to have next Saturday, okay, the internal auditor exam. So you better get some updates or prepare on that. Okay, if you need model papers, look at some NCs. Look at some model papers if you want. I'll share it. But I want all of you to do good on get at least 70%. I'm least bothered about 70%, but everything, if you practically understood, you should be able to do it right. Okay. Okay. So for today, I'm closing it and we'll meet it tomorrow or next Friday. Or I'll schedule somewhere in between when you are free. Let me check out. Okay, anyway, I'll be in touch with you. Take care, guys. Bye.
Okay, sure. Goodbye.
Mhm.